Alright, so if we're starting with the vertebrae, as far as the general anatomy of the vertebrae, things to consider are obviously going to be the body of the vertebrae. Between the bodies where you would typically find the intervertebral discs. Right, as you go posterior to the body, the next structure to consider would be the bony pedicle. This kind of bony bridge that's attaching the body to the posterior structures. And so you would see the pedicles there. Posterior to that, you see the superior articulating process. So the structure that's jutting out from the surface here is the process. But on the posterior aspect, you also see the nice flat superior articulating facets. And so these facets are what will allow the vertebrae to connect with one another as they stack one on top of the other. Right? So that's what the facets are there for. And just to kind of show you the opposite of this, on the posterior aspect, you see the posterior articulating process and facet as well. So you see those structures there. As you continue to go posterior, you see the transverse process. This bony process is there. And then you have your lamina here. Right? So these bony bridges that are going to attach the spinous process to the rest of the vertebrae are the lamina. And then of course you have your spinous process. And in the center you see your vertebral foramen. Right? So that vertebral foramen would that be that structure there. And finally, the last foramen to consider is when you have two of these stacked one on top of the other. Between them, you see the intervertebral foramen. And in life, that's where the spinal segments or spinal nerves would exit from. And so that's the general anatomy as far as the vertebrae go. Now, for the individual types of vertebrae, we're going to start with the cervical vertebrae. Keep in mind you have 5 cervical vertebrae. And to name these, you're just going to name them based on their position, starting from the superiormost, making your way all the way down to the inferiormost. So by position, this technically would be C1, and this would be C2, and then you would subsequently follow that C3, C4, C5, C6, until C7. Now for C1 and C2, these are fairly unique compared to the other cervical vertebrae. C1 is also known as the atlas. And you can see that the atlas is, by shape, pretty unique. There is no body on the atlas. Instead, you have an anterior and posterior arch, and you have these large articulating facets here where the occipital condyles will articulate. Right? So the atlas then is what will articulate with the skull above it. So that's the unique feature of the atlas. If we look at C2, you see that C2 now has a spinous process, right? This one didn't have a spinous process as well. But C2 has a spinous process, and it also has this large process that is jutting out from superiorly. Right? This is known as the dens or the odontoid process. Now, the other name for C2 is going to be the axis, because as you can see here, the atlas will articulate with that odontoid process, and it will use that as an axis of rotation. So this is what allows you to turn your head. So those are the 2 unique cervical vertebrae. Now, generally speaking, when you look at the cervical vertebrae, as far as identifying cervical vertebrae and differentiating them from the others, you're looking at the small nature of the vertebrae, right? Very thin, small bodies. You can look at the spinous process that is typically going to be bifurcated. And finally, the most distinguishing feature of these cervical vertebrae will be the transverse foramen. So these transverse foramen are only seen on cervical vertebrae, and in life they're going to allow blood vessels to pass through. Right, so that's the biggest feature you would look for those guys. As far as the thoracic vertebrae, which would be the next vertebrae moving inferiorly, there's going to be 12 of these. As far as the distinguishing features, one, you can see the spinous process almost points straight down and it's very sharp and pointy. 2, and probably the most distinct feature, at the posterior aspect of the body, on the models it's kind of hard to see, but you see these kind of rough surfaces. These are going to be the costal facets. Right, so the thoracic vertebrae are the vertebrae where the ribs will articulate. So the heads of the ribs will fit or articulate with those costal facets. Right? So you can use those to identify thoracic vertebrae. Besides the costal facets, on the transverse process, you also have a transverse facet. And that transverse facet allows the tubercle of the rib to articulate there as well. And so you have that kind of two-point articulation there. So to identify these thoracic vertebrae, those are probably the two structures that would help you out the most. And then as far as the lumbar vertebrae, there would be 5 of these total, and the biggest characteristic here is that they're large. You have large bodies to support the weight of the upper body. The spinous process tends to be kind of large and blunt, and so that's kind of the biggest feature that you would see there. And those are the vertebrae.